Good day everybody, I am Dr. Chinmay Nakwa. I am a retinal surgeon at Aditya Jyot Eye Hospital, and today we are going to discuss about a condition called age-related macular degeneration. So what is the macula? This is something related to the back part of the eye, which is called the retina, and the centermost portion of the retina is called the macula. Now this part is responsible for most of our clear vision. If you can see me, if you can see my features, or if you can see the smallest print in the newspaper, it's because your macula is healthy. Now what happens with age is, as we age, there are certain areas of the macula which lose their function. So age related macular degeneration happens in people above 50 years of age and above that, and it gradually destroys the small photosensitive cells in the center of the macula, and people might lose the ability to distinguish between two small objects at that age. So there are two forms of macular degeneration. There is a dry form and there is a wet form. Now the dry form is the most common in the population, and it affects more than 90% of the people. And what happens in this is the photoreceptor cells in the center of the retina, they degenerate. So the vision might be a little blurred in these people as compared to people without macular degeneration. And this is especially with regards to the central vision. The peripheral vision is generally very good. And the second form is the wet form, which although it's not very common, but it can be visually devastating because there is some leakage in the center of the macula. There might be some bleeding in the center of the retina, and this can lead to a very sharp fall in vision, and if it is not treated in time, the loss of vision might be permanent at times. So on my screen you can see a photo of what we call as a dry macular degeneration. The yellowish colored spots are what technical terms we call drusen, and there's a lot of pigmentary changes in the retina, which means that the photoreceptors over there are not very healthy, and this is what many people above, let's say 65 or 70 years of age, they would have in their retina. And now if you see on my screen is a picture of a wet ARMD, wet macular degeneration, in which there is a scar in the center of the macula. Now this person will have a very profound loss of central vision. He might not be able to see or identify people very clearly. He might not be able to read the smaller print in a newspaper, and this can cause a much greater loss of vision than a dry macular degeneration. And that on my screen, if you can see, is how people with macular degeneration perceive their vision to be. So in the first photo, well, it's very clear. In the second photo, the object of interest, if you're looking at the child's face, you would not be able to see the face very clearly. The surrounding picture might be clear, but the central vision is compromised due to macular degeneration. Now what are the risk factors? Who gets macular degeneration? Obviously this is age related, so as age progresses you are more at risk to get macular degeneration. This is something you cannot help, but there are certain modifiable risk factors which you can control, and smoking seems to be a very important risk factor. So if people who are smokers tend to progress much more faster than non-smokers, so that's something you can control. There are certain racial predispositions, so it's seen that Caucasians are probably a little more prone to develop macular degeneration as compared to non-Caucasians, and sometimes family history. So this brings genetics into play. So if some people are genetically a little prone to develop macular degeneration, well then that's again one of the risk factors for developing this condition. So what can be done right now? So there is a simple diagnostic tool. This is Amsler's grid, what I'm talking about. This is not an exercise, this is not a treatment. This is a self evaluation tool, and it's very simple, and it can be done by many people, practically everybody sitting in their houses. So this is what the grid looks like. It's a small square sheet which has horizontal and vertical lines and a central spot. So we train people to look at this grid at periodic intervals using one of their eyes when it's held at a reading distance, and if they notice any sort of distortions or black spots or missing lines or certain haziness in the grid in any area which was previously not there, then that should raise an alarm, because this can mean in some instances that there is something going wrong in the retina. And if people who are trained to use this grid regularly, if they report on time to a retina physician, then we can actually prevent any permanent loss of vision due to this condition. So talking about prevention, what needs to be done? So everybody who is above 50 years of age should at least have an annual eye examination. So there are many changes in the eye which happen with age, and once you get a comprehensive eye examination done, most of them can be detected, and we can treat them in time and prevent any further loss. Like I explained, the central vision can be monitored using Amsler's grid, and if taught and followed properly, this can be quite a useful tool. And any changes which people at this age notice, and if you seek care in time, then we can prevent any permanent vision loss. Obviously, you need to eat healthy, you need to stay active, and smoking is not very good for you. So eat healthy, what does that mean? So if you have a diet which is high in antioxidants and essential vitamins and minerals, that is what we recommend. There should be a lot of color on your plate. It should not just be black and brown and white, and rice and chapati will not help you, but a lot of vegetables, a lot of fruits. They contain beta carotene, they contain natural antioxidants, and these are seen to prevent the progression of these age-related macular degeneration. There are also certain antioxidant formulations which are scientifically proven to slow down the progression of macular degeneration. There have been many studies carried out worldwide, and there are specific formulations for the retina. So we do prescribe these to a few people with dry macular degeneration in order to prevent the progression of retinal macular degeneration. Now, what happens when you come to a doctor? When you come to a doctor checks you, and this on my screen right now is an investigative modality which has revolutionized the way we practice retina. It's called an optical coherence tomography. It's basically nothing but a scan of your retina, and even a small change in your retina can be detected with this. So your doctor has the ability to diagnose a wet degeneration very early, before it has caused any real damage, and if it is detected that early, then obviously we can prevent it from going bad and causing any permanent damage. And in wet degeneration, now the recent advances in pharmacology and in medical science have made it possible to actually reverse to some extent the damage caused by wet macular degeneration, and these involve certain medicines which are given inside the eye, and they can act dramatically. But of essence, what is important over here is that we check people in time before it has caused a scar or any permanent damage to the eye, and if we can treat them at this point of time, so then we can prevent any permanent loss of vision. And so what at the gist of the whole story is, if you come in time, we can treat you well before it causes any permanent loss of vision. So every person more than 50 years of age should have at minimum an annual comprehensive eye examination. Thank you.